is so important that employees of Alacare and the community give to the Hospice and Home Health Fund of Alabama, because it's helping the people in our communities. It's helping the patients that we serve every day. As clinical staff, we go into the home. We see what the needs are. By talking to the Flukers, I hope you see that the money that's being given is helping your neighbors.
My name is Helen Fluker, and I was born and raised in Goodwater, Alabama.
And I'm Bill Fluker, and I was born right up the road there in Hollins. We've been married for this coming April the 30th. It will be 48 years. We got 6 children, and we got 14 grands, and I had to count up 5 great-grands.
When I was referred to come out and see the Flukers and coming into the home, I knew that they needed assistance with long-term care planning.
The stroke happened in September. I don't know the exact date, but it was first part of September, 2015. So it happened on the right side, but it affected her left side. And so her leg and her arm and her left side.
All on the left.
But I haven't got back right yet, but we hoping and believing that it's gonna.
Alacare stepped in, they did a good job.
There were no needs financially that were identified by the clinical staff, because the Flukers aren't the top that are going to tell people that. But in coming in and discussing long-range planning as to how Mr. Fluker was going to care for Miss Fluker, I identified that they did have financial needs. With Miss Fluker having the stroke, her needs, they had to purchase a lot of different items that they had not had to before. And when I got here that day, they did have limited food in the home. So at that time, I was able to make a fund request through the Home Health and Hospice Fund, and they were able to approve that and sent me a check. So I was able to go to a grocery store. Miss Fluker is on a special diet, so they gave me a list of the things that she could have. And so I was able to go and get those things and bring them back to their home. And as I came through the door, to see their eyes light up, you could tell it had been quite a while since there had been that much food in the home.
They brought all that food up. I said, this is enough food for a whole month.
Yes.
All they did just laugh.
And some supplies. So
that's great. Our job. Yeah, that was so beautiful.
We have very little. Our income is so low for the two of us. We barely make ends meet.
If they didn't come by to help us, I don't know what we'd do.
I thank God that they're for Alacare. I really
me
do.
too. I thank God.
I've been a social worker for 20 years, and since being with Alacare the year and a half, I know that if I have a patient that has a need and I make a fund request, I know that need's going to be met.
My father, Charles D. Beard Jr., recognized fairly early on that Alacare saw a lot of elderly people with multiple chronic conditions, and of course their cost to care for themselves with all these conditions and multiple medications and seeing multiple doctors, it didn't leave them a lot of income left to support their standard of living. What he found was that our staff, our home care aides in particular, and our nurses, they were taking money out of their own pockets to help support the families if they couldn't pay the power bill or the water bill, or they needed a little extra money because they couldn't pay for the medications. So my dad set up the Hospice and Home Health Fund, and he asked all of the staff to make a contribution to that so that our staff in the field wouldn't be faced with having no answer for these sort of problems.
The Alacare Home Health and Hospice Fund is one of the, I feel it's one of the most wonderful things that we have there at Alacare. It is all of the Alacare family given to those that have needs. I have seen many patients with many needs, and that Alacare Home Health and Hospice Fund has really, really helped those people.
I have seen them put roofs on homes, floors in people's houses, heaters, air conditioning, whatever the needs that our patients have, pay light bills, phone bills, gas bills. When we go in, we're family to them, and their needs become our needs. And to be a part of this fund is giving back to the people that give so much to us.
We get contributions from our staff, we get contributions from other organizations, We have a fundraiser every year called Founders Day. My dad's birthday is May 2nd, so we have a Founders Day celebration around his birthday. Of our staff who decide to voluntarily make a contribution to the Hospice and Home Health Fund, we try to make the process simple. They can fill out a form, and we will do 1 hour a week of their salary into the fund. That's every 2 weeks, or just 1 hour every month. It just depends on what their election is. We try to get them during orientation when they become new employees to understand what the fund is doing and to make that election then, and sometimes they're able to do it and sometimes they're not. And then sometimes, their own personal situation is, they have changes in their personal life and they have to contact us and tell us they can't afford to give that 2 hours of pay a month anymore, which is understandable. I mean, especially, one of our most generous groups of people really are home health care aides. They're far generous than financially I think most of them can afford, and I really appreciate what they do every day in taking care of our patients. My dad used to say all the time, it's far better to be the giver than to be the getter. I mean, he really felt that way. I mean, we should always be in a position to give to others, and it's a blessing from the Lord that we are in that position. So we should definitely not shirk our duty, to be generous when the opportunity arises.
I think all the employees at Alacare that give to the Home Health and Hospice Fund and then get to sit and as we present, on a quarterly basis, how much of that fund has helped to see the employees, their reaction to it. I mean, they're just ecstatic about it. Because of their giving, they were able to help someone.
It's all a blessing. As my old Granny Graham, who lived to be 94, used to say to us, Sonny boy, there ain't no luggage racks on hearses. So you're not taking any of this with you, So you should spread it around a little bit. And it's important for us to teach that and make that opportunity available not only to our staff, who are by nature very generous people, but also to our children. I think that's an important lesson that we have to teach everybody.